I'm Carolyn Davies and I'm a project officer at the Centre for Excellence. Before we begin and I introduce people, I'll just start by acknowledging the traditional owners of the land where we live and work. Wherever we're tuning in from today, we acknowledge that we are each on unceded land, and I pay respects to elders past, present and emerging, including any Aboriginal colleagues who are joining us today. In our session today, we will be hearing from Dr Georgina Sutherland and Medea Rangi, whose research is currently investigating the topic building a framework to prevent and respond to young people with disability who use violence in the home, which is quite a mouthful. I do need to stress that today's webinar is about presenting some really early findings in their work. However, I think this discussion, even in its earlier phase, is still important because I think it presents some conceptual challenges in how we understand and think about adolescent violence in the home. Now, at the Centre back in 2019, the results of our cross-sector survey and consultation forum suggested that while practitioners had reasonable confidence about a range of content areas, there is a knowledge gap in relation to working with young people with disability who use violence. And we've had an excellent turnout for today's session, which I think also goes to show the appetite for information on this topic. So I'll now pass over to Georgina and Medea. Thanks, everyone.
Thank you, Carolyn, and thanks for that intro, and to the Centre for inviting Medea and I to share, and I will again stress early findings from the project, the ANROWS-funded project, Building a Framework to Prevent and Respond to Young People with Disability who are Violent at Home. Medea and I are both joining you on an absolutely gorgeous day in Melbourne. Melbourne is the colonial name for the city where we live, and I would like to acknowledge that we're on the stolen lands of the Wurundjeri people, pay my respects to elders past and present, and to any First Nations people who are joining us on this webinar today. Medea and I are both researchers at the Disability and Health Unit in the Melbourne School of Population Global Health at the University of Melbourne. I have a background in public health and have been really using that public health lens in my work in family violence over the past around 10 years. I have a particular interest in prevention and in primary prevention. And I also work at the sort of intersections of violence, disability and gender. And I will, Medea will sort of take on the second part of this presentation, and she brings to this project quite a different background to me, and she'll introduce herself. So I'd like to acknowledge colleagues and co-investigators on this project, Professor Anne Kavanagh, who's Chair of Disability and Health and who's Head of our Disability and Health Unit at the University, to also Associate Professor Cathy Vaughan, who brings extensive skills around sort of participatory research, qualitative inquiry, young people, disability and violence, and is head of the Gender and Women's Health Unit. Dr Tanya King, who's a Senior Research Fellow and has a early career fellowship from the ARC looking at young people and caring, and also to Professor Gwyneth Llewellyn at the University of Sydney, who brings really extensive histories in families and systems and young people with disability. What we want to present to you today is both like a bit of a behind the scenes look at the work that we've been doing. So the opportunities and challenges that the research has presented, how we came to do what we've been doing, why we approached it in the way we did, and also to present with you some of what we've been finding along the way. Medea is going to present some work that sort of we're still in data collection right at the beginning of analysis. So what she's going to present to you is more just like some sort of snippets and maybe some stimulus for discussion, so we can maybe get some feedback from this group, which we're sure we can inform our work. I want to start with some just broad reflections about the broad area of adolescent violence in the home, or AVITH as the acronym is commonly used in Australia. Before I delve into some of the specific issues around young people with disability and some of our specifics around our project. We know there's lots happening in this space, particularly in terms of policy and services, and there's a particular hive of activity in Victoria. And although AVITH is a very specific sort of social issue in many ways, the activity in prevention and response is diffuse, and it sits across lots of different disciplines and sectors. So child and family violence services, domestic and family violence services, in sort of justice responses with the police and with the courts, child youth mental health services, both in community and hospital settings. And hand in hand with that activity, really what we've been hearing when we've been engaging about this study is a real eagerness to know more and a bit of a sense of urgency really to start to understand the problem in a much better way. So while we understand that AVITH is defined, or it defines violent, abusive, coercive, and threatening behaviours used by a young person against members of their family, mostly parents and siblings, conceptually it's really very much in its infancy. And what we do know is often sort of supplanted or borrowed from adult perpetrated contexts of violence, particularly in relation to family and domestic violence. And we certainly know it does share common features. So there's a gendered dimension where violence is more likely to be used by adolescent male children against female family members, although the gendered pattern is certainly more complex when we're talking about the use of violence by young people. It can take many forms: physical, emotional, verbal, financial, and sexual abuse. It can be directed towards people, property, and/or pets, any combination of those, and is experienced as an ongoing pattern rather than as a one-off incident. I'm not sure, Carolyn, whether we were going to leave questions to the end. I'm happy to answer them as we go, if you would prefer.
I think if anyone has any burning questions, please add them to the Q&A and I can interject if we need to. Otherwise, we'll keep it mostly to the end, I think.
Okay, no problems. I see things popping up on my screen. I just thought I would check in with you.
It's okay, we'll monitor that.
Okay, I'll keep going. But there's still lots that we don't know. So, and there's many reasons for that. We don't have very good data in Australia, and there's lots of other parts of the world where we don't have really good sort of robust community-based or inclusive ways in terms of surveillance and monitoring family violence. I think we could broadly, but also specifically around AVITH. And that sort of systems really help us to understand the nature and extent of the problem. But even if we did have systems that were really robust and inclusive, we know that there's a reluctance to report the issue as well. And we know that this is particularly problematic for families with young people with disability whose experiences in the sort of general support service system has been poor in terms of difficult to access and then treated poorly within the systems. So when we think about a lack of conceptual clarity around the issue of AVITH broadly, we know that it's then amplified when we consider the experiences for young people young people with disability who engage in AVITH, and the experiences and impacts for their families. Oops, I've gone too far. There we go, back again. What we do know is that young people with disability are commonly identified in AVITH populations, so in studies, in clinical and administrative samples. And in terms of the evidence base, and certainly from our initial observations, and these have been confirmed as we've moved through the research, is that disability is identified or described mostly as a risk or explanatory factor for AVITH. Because young people with disability appear in study samples, but it's conceptualised as an individual level risk factor. And by this I mean disability is considered, or at least described alongside other what we would think about as maybe embedded or inherent characteristics, so things like age and sex, and rather than disability as resulting from an interaction between a person's impairment or health condition in their environment. And it's this interactional understanding of disability that underpins Australia's obligations under the United Nations Conventions on the Rights of Persons with Disability, but it's also this interactional understanding that informs the disability policy frameworks in Australia, like the National Disability Strategy and the new one that will take over from the old strategy, which is Australia's Disability Strategy. And I'll just provide a very quick example here. In terms of what we mean when we think about the interactions of disability and AVITH, and Media and I were in a really interesting conversation yesterday where we were hearing about the relevance of school experiences and relationships with peers and pathways to AVITH. And there is a small body of work that actually does explore bullying and its co-occurrence with AVITH. But what it does is that it ignores the exclusionary and discriminatory practices that act as barriers to young people with disability and inclusion in schools. And it's really these interactions that are missing from the evidence space. And we will loop back to that further in the presentation. But this was really the starting point for our project, which we'll talk a bit about now, which was to unpack the experiences for young people with disability and AVITH that are aligned with these contemporary understandings of disability. And our overall aim was to develop an integrated conceptual framework for understanding and responding to young people with disability. And we've proceeded really through it with two key sort of stages of the project. The first one was the evidence building phase, which I'm going to speak to. And then the evidence building phase has been used to inform the second phase, which is the qualitative inquiry with young people with disabilities, family and stakeholder representatives, and Media will talk about that, each with its own sort of sets of challenges. For the evidence building phase, our main challenge was that we started to consider how we would build the evidence using a pretty sort of standard academic approach where we gather all of the evidence that there is in one place. We were looking to synthesize research that had specifically looked at AVITH and young people with disability, and by doing this address some of the shortcomings in prior reviews of the literature that position disability only as disability is only talked about because people appear in the populations, but there's no other considerations given to that particular population. We were aware that we were dealing with an area that hadn't received much attention, so we had very broad ranging searches of the literature. We did that over multiple iterations, and what we really found was that young people are entirely absent from the evidence base on AVITH. So responding to that, we thought we would take a different approach to building the evidence. So what we did was we undertook a conceptual review. And by this, I mean, rather than sort of sticking to a narrow systematic approach through where research all sort of sits in one place, a conceptual review enabled us to sort of bridge different bodies of knowledge and to build what we call conceptual families. So to think about where was the relevant evidence for young people with disability, where were they missing from the evidence base in relation to AVITH. We had three main objectives: to identify critical gaps in the current state of knowledge on AVITH that are pertinent to the experiences of young people with disability, to overview the dominant theoretical paradigms that inform policy and practice, and also to examine factors associated with AVITH and explore how disability is understood. And we frame that within the socio-ecological framework. I'm just going to talk to the first and third component because we don't have a lot of time today, and we really wanted to provide a broad overview, then get right down into the nitty-gritty. But we do have a report coming out that, a larger report that will be launched by ANROWS in the next couple of months. So for those familiar with the evidence base and have read some of maybe the general AVITH literature, I think some of these critical gaps won't come as a surprise. So there was 5 critical gaps that are listed there. The first one around definitions, language and data. So as many of you will know, there is no universally agreed definition of AVITH, and I think that's in some ways an impediment to advancing knowledge in the field. But there's also lots of different variations in terms of how the developmental period of adolescence is described is quite different across the evidence base. The language used to describe violence is different. The way violence is measured is different. And of course, there's the lack of the robust inclusive data that I've already mentioned. I think most relevant here and most relevant across sort of, I think might have just frozen there for a minute. I think, excuse that, I think that's my internet being funny. I think most relevant is, Medi has given me the thumbs up that I'm still here, that's good. Most relevant to this area and across actually the whole, our whole project is that we really uncovered that there's two sets of literatures that, two sets of complementary but distinct literatures or body of knowledge that often have very little points of crossover, but in many ways should. So on the one hand, we have a general and growing body of literature, international literature on AVITH, which comes with its limitations around how it considers disability. But we have this second lot of literature around often what's called challenging behaviours. Sometimes it's called complex and challenging behaviours. Sometimes it's called complex disability support needs. There's a range of ways that it's described, and it covers, it's mostly in relation to young people with developmental and or intellectual disability. However, the phenomenon described is quite heterogeneous. So it can describe, sometimes it's described complex needs associated with a young person. Sometimes it describes complex needs associated with their parents or the interaction of the two. It may include behaviours like self-injurious behaviours, physical, verbal, sort of violent behaviour at home, but also it can include behaviours in school and in other service settings. It considers destruction of property as well as inappropriate and harmful sexual behaviours. And while some of those behaviours that are described in sort of this challenging behaviours literature fit within the commonly used definitions of AVITH, so that violence is directed at members of their family, it takes many forms, it's ongoing and results in families living in fear, the issue is never or very rarely framed as AVITH or even framed within the broader sort of family and domestic violence space. So there's a real disconnect between these sectors where there's clear points of intersection, and we've tried to think about how we can join those literatures together. The second critical gap is a lack of attention to age, developmental stage, and family relationships. So really thinking about AVITH within quite narrow definitions of chronological age, rather than thinking about developmental trajectories and the way that might differ for young people with disability as opposed to young people without disability, and also family relationships and cohabitating patterns for families with young people with disability. The third critical gap was around the focus on data from specific sources, so data that comes, say, from police incidents or from legal responses. Really valuable data, but often limited by understanding really the complexity of AVITH. The intersection of AVITH, gender and disability. So we often see literature around gender and AVITH, but not around thinking about gender, AVITH and disability. And we were really struck by the lack of attention to some of the more structural gendered sort of practices and norms around caregiving, particularly women who are more likely to be the primary caregivers of young people with disability, intersections with victimisation. The final one is around intentionality, and it fits back with the definitions and language, but it's really around the definitions and terminologies in AVITH that have a very central and explicit focus on intent and purpose. So the intent to coerce, dominate and control family members, and or the intent to cause harm. Yet for young people with disability, particularly those that might have impairments associated with difficulties with communicating or navigating social interactions or with emotional regulation and control, behaviours may be violent, but in the absence of this sort of intent to cause family members harm. So behaviours that are used for other purposes. And The research that focuses on challenging behaviours, unlike in AVITH, it tends to focus on outcomes and impact over issues of intentionality and purpose. So there's quite a difference there in focus. In the final part of the research, we focused on the contextual factors in AVITH. So what is identified in the literature as co-occurring with AVITH, and explored then how disability is understood and situated within this socioecological framework. We purposely called these contextual, even though it's probably more common in the literature or more commonly referred to as risk or at-risk factors. Just going to let my dog out, who's barking at another dog. But we've been a bit more cautious here because it feels like when you talk about risk or at risk that there's some implications around causality. And really the research in AVITH has not developed in a way that we can really say much about sort of cause and effect relationships with AVITH. So we've been very much more cautious about how we describe what other people might call risk factors. We've also purposely couched the contextual factors within this socioecological model that I'm sure many of you are familiar with, and we've done that for a couple of reasons. It's a really, and maybe that's just my lens because I've been working in family violence for a long time and this is commonly used in that field, but it's a practical, really very practical way of considering the complex interplay between layers in the model and then how those sorts of factors interact and put people at risk, both in terms of violence perpetration and victimisation. And then the overlapping rings illustrate how those factors interact with each other. And it also, what really struck Medya and I when we were working on this is it aligns really well with contemporary understandings of disability, understanding how impairments interact with other components in the socio-ecology across sort of relationship, community and society factors. So I'm just going to go through a couple of these, which again are more sort of fleshed out within the larger report. So at the individual level, one of the most sort of consistently identified contextual factors across sort of adolescent maladaptive behaviour, but including AVITH, is exposure to childhood adversity and trauma, often use the acronym ACEs, Adverse Childhood Events. And this can include exposure to family violence in the home, either directly or indirectly. And there's also research that suggests that children and young people with disability have an increased risk of experiencing adverse childhood events compared to their typically developing peers. And in fact, in our initial search, and when I talked about we didn't find anything, we actually found really large matches when we were looking at the whole literature on violence in young people with disability. But the overwhelming majority of studies related to children and young people with disability as victims, survivors of child sexual abuse or adult perpetrated violence. So there's very little that directly speaks to AVITH and the experiences of adverse childhood events for young people with disability. And what I've written here is the focus remains what is wrong with you, because actually what the contribution of the ACEs literature has been to shift thinking from what's wrong with you to what happened to you. But there doesn't seem to be this commensurate shift with disability that is stuck very much in this sort of outdated medical model that positions disability as being different from the norm. In terms of the relationship level, we look at one of the key contextual factors in the AVITH literature is family dynamics. And there is a relationship between family dynamics or functioning, sometimes called dysfunction or dysfunctioning in the literature, and AVITH. It covers a range of issues around families. Sometimes it includes parenting practices. It can include parents' mental health and substance use, family stresses broadly, and conflict. And there's a number of small scale studies that suggest families of children and young people with developmental disability, and this literature is quite a lot of this literature is focused on autism spectrum disorder, but they experience many of these same factors associated with AVITH. So increased levels of physical and mental health issues, elevated levels of social isolation, emotional and financial stresses, and high rates of family conflict, parental separation and divorce. But the research sits really largely disconnected for understandings of AVITH. I'll finally just touch on the community level that I talked about earlier, and this is around experiences at school. So there's evidence to show relationship between young people's experiences at school and AVITH. Again, it covers a wide range of issues related to academic performance, relationships with staff and other students, also around school attendance and school refusal. But the literature on school experiences and AVITH to date has not considered school as a disabling environment where children and young people with disability disproportionately face barriers to both inclusion and then performance. And really bullying is a pervasive experience in young people's lives. And I think particularly the school experience, I think, will be something that in the context of COVID will become a really important part to look at, because, you know, and Medium, I don't know if you're going to touch on this, but there's certainly in our interviews with families who've talked about disruptions to school, disruptions in transitions from school that have really impacted on the lives of young people with disability and their families. And I think that's going to be a really important issue as we talk about sort of recovery from COVID. The final sort of outer ring of the model is the social sort of society level factors. And I'm not going to go into any depth here, but to say there's a really major and concerning gap in the AVITH literature broadly. And the gap is problematic for understanding young people with disability and AVITH, and the extent to which prevention and response really needs to consider across the board the sort of structures, systemic structures and practices, and also policies that maintain inequalities between young people with and without disability. I'm going to leave that there as sort of an overview of the evidence building phase. And Media and I are just going to do a quick changeover where I'm going to stop sharing my screen and Media will start. Hopefully this goes smoothly.
Perfect. And Medea, while you're just setting up there, we've just had a question, Georgina, that might be useful to look at now. And the question is, do we know how specific forms of disability and trauma intersect with AVITH?
A great question. And I think that what we currently don't know enough about broadly the issue, and I think that understanding if we want to break down, so the question was around impairment types or types of disability. Broadly, we don't have enough really about adverse child experiences, let alone the different types and its relationship with AVITH. But that doesn't mean perhaps there's not some unpacking we can do within the sort of broad adverse childhood experiences and disability literature and be able to link that up to AVITH, but certainly not within the context of AVITH.
Hello, can you hear me? And can you see my screen? Okay, that's great. Yes, hello, thank you all for joining. I'd like to acknowledge that I'm also on the Wurundjeri land of the Kulin Nation in Narm, where sovereignty has never been ceded. I pay my respects to Aboriginal elders and all the First Nations individuals that are joining us today. My name is Media and I'm a cultural anthropologist by training, with background in ethnography, working with underrepresented and marginalized communities. I have been working in public health on a range of projects at the intersection of disability, gender, and cultural identity. In this presentation's discussion of preliminary findings, I use the phrase young people with disability and complex needs to include a range of health conditions and disability, including those with lived experience of more than one disability. For example, when a person is diagnosed with intellectual disability as well as developmental disability. This phrase also includes complex individual and family circumstances, which may include adverse childhood experiences, such as serious illness in the family, experiencing and or witnessing domestic violence, neglect, and abandonment. This phrase is also informed by our research findings and aligns with the sociocultural framework that Georgina just discussed. Initially, we planned to capture the voices of young people with disability directly, as well as family members caring for young people with disability. However, due to the limitations brought on by the pandemic, as well as methodological limitations, we learned that we were not able to engage with young people as we originally had intended to, at least not directly. The pandemic-related restrictions also placed logistical limitations on reaching family members who were often at home with the young person. However, the pandemic also offered us the chance to speak with family members across Victoria via phone and discussed the impact of the pandemic on their experiences with AVITH. We also interviewed stakeholders from a range of sectors that engage with AVITH in various capacities, including but not limited to carers advocacy organizations, community service organizations, and AVITH providers across Victoria. These interviews have helped us to better understand barriers and enablers to services and resources that are available for young people with disability and complex needs and their families. So we are still completing the data collection right now. Therefore, the following discussion is based on a very preliminary analysis of emerging themes from interviews with family members. One of the main emerging themes so far is the family members' understanding of the ways in which the young person's disability impacts their behavior. For example, the primary caregiver of a young person with intellectual disability, ASD, and ADHD explains issues with managing anxiety and dealing with disciplinary commands. Here's a quote from this family member. He gets extremely anxious, and then when he gets anxious, his cognitive capacity is compromised. And his lack of language or insight kind of led him to, for example, if he wanted to remove himself from a situation, he would escalate behavior, do inappropriate behavior. It was just apparently his way of exiting play because he had difficulty entering, maintaining, and exiting play with peers. Being told no. If he was switching on and off, on and off, on and off, and you went and put your hand on him to stop. The next emerging theme is the intersection between choice and control and intent to harm. So for a number of family members, while they understand and experience certain behaviors as violence and acknowledge the harm they cause, some explain that the reasons for the young person's use of violence is often to make themselves feel safe and to establish a sense of security. Here's a quote from a family member of a young person with oppositional defiance disorder, parental attachment disorder, and ADHD. He's got a great sense of justice and what's fair. If he doesn't think that things are fair to him, then he has a real problem. I think that all of this stems from that he doesn't trust people. He doesn't even trust me. He doesn't trust anybody. He doesn't feel safe, and he doesn't like it when he's not in control. Control is how he makes himself feel safe, and all of that stems back to his dad. His intent is that when I can be in control, that means that I'm telling you what to do. I'm telling you what I will do, and you are under my control. I am abusing you. I'm yelling and screaming and getting my way. Not only does that put me back in control, and when I'm in control, I feel safe. So his intent is always to gain control to feel safe. Next is family members' views on missed opportunities for early intervention through community and health organizations, and its impact on their family as a whole. Here's a quote from a family member of a young person with the intellectual disability and development disability. When we call the police should know that there's a service available that can help families like ours. We don't have to wait until violence has been perpetuated on us or our child, and that we can get into a highly specialized, responsive, and accessible service. And that would have made a massive difference. I may still be married. My children may not be treated for PTSD. My son may have had a much more productive and less stressful journey through school and his life and still be living in the family home, or still have great relationships with his broader family, because so many big bridges have been burnt where he's been violent. You know, our lives would have been very different if we had have got help a lot earlier on. The next major theme so far is families' concerns with limited specialized services available for young people with disability and complex needs. Families often experience that service providers are not equipped to provide appropriate support for multiple disability and complex circumstances, along with issues with funding and coordinated support, or lack of. Here's a quote from a family member of a young person with intellectual disability and development disability. And he's eligible to go into STA, but it's an in-group accommodation only, not on his own. And so we were faced with having to send him to Bendigo, an hour away. He would have had to have been taken there by the police for start, and he would have probably bashed up the other person he lived with because of the stress he would have been under. The NDIS keep talking about choice and control, but because we're in regional Victoria with complex behaviors, there's not a lot of skilled people in that area. He's one of the most complex, challenging clients that you can get. And there's not too many of them around, but it is made harder by the fact that NDIS funding is not recurrent to services. It's the user pay model. So again, in terms of being able for a practice to be able to offer that kind of key worker model, they need to have some kind of surety of funding. And one final one that I'll share with you today is that some families experience difficulties in being linked to services that can provide emergency support for their children's complex needs in moments of crisis that do not involve some form of institutionalization, for example, within the justice system. Here's a quote from a family member of a person with intellectual disability and developmental disability. We were begging for help, for somebody to come and take him, or to find us somewhere for him to live. And Protective Services' response was, well, it would have to be a prison cell because we've got nowhere than emergency basis for him to go. The only way he could get help would be for you to have him admitted to hospital, and then you refuse to pick him up, or that if he entered the criminal justice system. And the other thing is that there needs to be resources available either when people ring Protective Services, the police, or a referral pathway with a pediatrician and other allied health workers for families or carers of children with behaviors of concern and complex disabilities, that when they're in an emergency situation, that there is a service. They should never be told what I was told, that we can't come and help you. The only way is if he's taken to a police cell, that's the only, and he'd have to sleep there until a solution was found. So these are some of the emerging themes that we have come across. There's many, many, many more. There's a lot that we could tell you, and we hope that we can do this again and give you a bit more of a comprehensive overview. Thank you very much. These are our details.
Thank you very much, Medea and Georgina. I guess my first question, just straight off the bat, is when are we able to hear a bit more about some of the conclusions of this study? Do you have a time frame in mind, or is that a bit far off still?
We have, I think I'm on, I can't see myself on video, but I think I'm there.
You're good, yep.
Because the project was divided into two components, that the conceptual review will be publicly available ahead of the second component, which is the qualitative inquiry. So we're anticipating, I mean, we're working on ANROWS timelines here, but we think that the roundabout timing is around March for the first component, and then in the second half of this year for the second component. So we're probably taking a bit longer than we originally thought. In fact, there's the project's probably a little bit smaller and taking a little bit longer than we thought, simply because of the sort of complexities of the area, trying to answer as many questions as we can, although we know there's an enormous amount that we would like to answer, and that we have people ask us that we feel a bit frustrated. I think that often we're saying, oh, we don't know that, or we don't know, because we know there's a huge amount of interest in this area. So our project probably ended up quite small, but took a lot longer. But that's a long way of answering. Around March, second half of this year.
Thank you. We look forward to hearing more a bit later on then.
Yep.
We've had a lot of questions come in regarding like language, the use of terminology. I'm just going to pick, sorry, I'll just try to filter one through. So I guess one of them, I think, which cuts to the heart of it, is regarding the differing terminology connected to adolescent violence in the home. What was the reason you decided to refer to it as violence versus naming it as challenging behaviour or some other term?
Yeah, I think that the language that we use in this project has been one of the really challenging parts of the project, because we use we use a particular language. So we use AVITH, or we use adolescent family violence, or we use sort of family violence broadly, and you capture up sort of sectors and disciplines that understand what you're talking about. And then I'm going to say alienate, it's probably not quite the right word, but we then don't connect with other sectors that use another language, but often they're talking about very similar things. So it is around finding a space where we can work, where we're capturing up as much of the language and as much of the people that we really want to speak to. I think that our role within the conceptual review, we started with this focus on AVITH, so that's where we've ended. But I think that when we are looking at our data, a qualitative inquiry component, I think we'll have more to say on language. And Media, I'm not sure if you had wanted to add something to this, but certainly we're finding that families of people with young families who are living with young people with disability will talk about challenging behaviours, but the language around violence also resonates. There are particular instances where they have read stories or narratives around AVITH, and it's for the first time they've really understood their experience. So you can see that there's sort of these complexities across the project that we're dealing with, in the language. And I mean, wasn't our role to come up with a definition that was inclusive of something like challenging behaviours. I think that would possibly be an interesting project. But the language has certainly been something we've been cognizant of. We've changed as we've gone. We've talked to people. We've some people really, really strong opinions of it, and we've really engaged with them carefully across the project to really understand how not to be pushing away certain sectors, particularly around the disability issues of sort of challenging and complex behaviours.
Yeah, very complex kind of overlap and parallels there. A question on a similar vein, can you say any more about the interconnection between intentionality, disability, such as intellectual disability or autism, and a gender lens?
At this stage, no. Apart from, I think, what we've already talked about, which is when we think about AVITH, often when we think about a gendered lens, the focus is often on perpetration, so who's perpetrating the violence, which is often young adolescents, male children. So, and I think that for this particular area, there's going to be a bit of a flip to that, which is really thinking about structurally about sort of traditional gendered roles around caregiving and around family breakdown in the context of AVITH, and then who ends up being the primary carer, so who's sort of sits there as the target in some ways of the violence, but also roles that women play within families of enforcing rules and disciplinary roles and the family dynamics. So that's something that we're hoping to pick apart a little bit through the qualitative inquiry. Media, did you unmute yourself to add there?
Yeah, I think I would just add to that that it's really, at this point, really difficult for us to make really broad generalized statements. But in saying that, we have come across this issue of gender in the role that caregivers play, right? So I think that's really important. So there was another quote that I really wanted to include, but didn't have time, which was, it was about the mother describing that she was really her son's safety blanket, if you like, right? So, and that's because she is the primary caregiver. And I think that's really describes the situation here quite well, that is different to AVITH outside of disability context. Yeah, I think I would just add that, but yeah, hopefully we can make more in-depth kind of discussions around this when we've analyzed everything.
Thank you. And sorry, something just, Georgina, that you were mentioning before, I think the centre has been, speaking a lot with a variety of service agencies in the different sectors. And one thing that we had picked up on was the use of the word perpetration, and that many people are, really consciously making a move to reterming that as, a young person's use of violence, or as other people have mentioned, use of challenging behaviours, but just trying to make some of those subtle shifts which take some of that focus away from the behaviour and bring into focus some of the other situational contexts that are going on for that young person. I'm just trying to, so I've got this quite a lot of questions.
Can I just add to that, Carolyn?
Oh, yes, sorry. Yep.
Yeah, no, I mean, it's not a response to it. And I use perpetration sometimes more grammatically, and I probably should change my language. But we've also had, interestingly enough, some people pull us up on language around use of violence as well. Okay. So, and it's connected to these issues around intent. So when you use something, there's an intent. So there's a preference for some people around people who are violent. So, and I think that takes quite a step away from the domestic and family violence space, where use of violence as a choice is a really sort of a really strong part of when we talk about violence. Whereas we've had conversations about just the word use within this context as well.
Yeah, that is a good point. Yep.
Yeah. Yep.
There's a couple of other questions. Sorry, my little brain is sifting through quickly. There's a question there in relation to missed opportunities in primary healthcare. Participant has said, I'm interested to learn where your work connects with the primary healthcare system, as GPs are often the first point of contact for families seeking support. Is primary healthcare being considered in the framework and research, and will the next steps lead to education for GPs and health staff?
Yeah, I'm probably going to answer this in a way that's not very satisfying. There's nobody in or outside the tent in terms of the sort of services and supports that we're thinking about in terms of prevention and response. Media, I don't think we have spoken to anyone in primary care directly in terms of our stakeholder group at this point, but that doesn't mean that we won't. And I understand that there's lots of different points within the system that young people and their families, and the GP system obviously in Australia is really important as first points of call in the health system. So that was a bit rambly. So I quite like the second part of the question is around, will they be considered in the framework? And the simple answer is yes, because really what we want to try to get at here is something that's very practical and useful in terms of prevention and particularly response to AVITH and young people with disability. But I'm not quite sure whether that's the next step. It feels like we need to have another step between the next step, and it's like, will the next step lead to education? Well, ideally we would like to be able to produce dissemination products that are very practical, but whether that's the next step from this research, I mean, the challenge that we have found, and that hopefully we've sort of been able to communicate through this seminar, is that we've really found such a lack of attention to this issue that, in many ways as researchers, our job is to sort of grab all the evidence there is and start to think about what the next steps are and how can we practically apply these. But in this case, we're just so surprised that there's really nothing that we're piecing together little puzzles, parts of the puzzles from different bodies of knowledge, that we feel like we're a bit far from thinking about, okay, what can we do for GPs, or what can we do? And we have these questions a lot. So from different parts of the network that are service and response network, including police, who are like, we would like some more practical information about how you do respond to young people with disability who are using violence in home, and that they might be called in terms of sort of first response or responding to sort of serious incidents. So that question comes to us a lot, and we'd prefer to be further down the track and be able to say, hey, we're going to produce all these great things that are going to help. And I think we will be able to, but I don't know that that's the next step.
Yes, in some ways it does still seem like we're still a little bit in that phase of conceptualizing and even still problematizing the issue to get a good handle on all aspects of working with young people, using violence in the home.
Yeah, you're right, Carolyn, and it's conceptually sort of really right back at the beginning in terms of generally, and that's not considering young people with disability who bring a whole lot more complexity, both in terms of their experience of their families, but of course for people who are responding to that behaviour as well.
Mm-hmm. Well, we might need to just start to wrap things up. I'd like to sincerely thank both Medea and Georgina for spending time with us today to give us some of those broad sort of overview of findings from their research. We've got quite a few questions here, so I might try and put it to our guest presenters to see whether they might like to answer some of those in shorthand that we might be able to post around to our attendees at a later point. As many of you may be aware, the Centre is doing a range of activities that try to highlight the need for developmentally appropriate and trauma-informed responses for young people using violence in the home. And so we have a bit of a growing hub of information that we can make available, or is available online. We can send that link around if you haven't already explored that space. We'll have a range of other webinars coming up this year, so we'll be sending out some details as soon as we can about some of the other calendar events we'd like you to book in. So thank you again to our presenters, and thank you everyone for coming along to listen to our webinar session today. Thanks everyone.